I'm Margaret Laws, Director of the Innovations for the Underserved program at the California Healthcare Foundation. The primary focus of the program is to help low-income and other underserved Californians get access to high-quality health care. We focus on affordability, which is a major issue in healthcare for many Californians. To that end, we're trying to develop and promote lower-cost models of care. We also focus on helping those who are eligible for public programs to get access to and stay enrolled in the programs that can help them receive much-needed healthcare services. One of the projects the Foundation's been working on for several years is called OneEApp. OneEApp takes the application process for public benefits from an onerous paper-based process to one that's automated and modernized. The following video tells you more about the story behind OneEApp.
The system for enrolling low-income residents in California in public health programs is inefficient and it's outdated, and more importantly, it serves as a barrier to access for many people.
The process for families is simply irrational. These are single moms with 2 or 3 kids navigating through the public transportation system. Really, to apply for the full range of programs that a family may be eligible for, they may have to travel to 2 or 3, 4 different locations, filling out complicated forms, giving the same information again and again and again. Your name, your address, your children's names, their date of birth, attaching the same documentation again and again and again.
In 1999, when we first saw the 28-page application for enrolling children in Healthy Families and Medi-Cal in California, we thought this was the perfect candidate to automate. We had conversations with state officials who clearly indicated that they were supportive of the idea but were not prepared themselves to initiate it. We asked if they would work with us in a partnership, and we set about to create a web-based application that was interactive.
We have some pretty strict rules with inside government, so partnering with the Foundation and the Foundation's partners in working on Healthy App helped us to see how a web-based interface could really jet propel our effectiveness, and it's that kind of demonstrated result that helps us to convince policymakers to trust us with public funds to then invest in technology.
Healthy App was piloted in San Diego County over a 6-month period of time, and we brought in the Lewin Group to do a business case analysis to help us understand, was this application actually making enrollment more efficient? The results of the Lewin business case found that we reduced errors by 40%, we sped up the processing of applications by 21%, and more than 90% of the applicants preferred enrolling using an online system. Our goal was to develop Healthy App, convince the state that this was the appropriate application for them to use, then give the application to the state, which we ultimately did, and then the Foundation's work in this area would be done. But several years later, the Foundation was approached by several counties who had started Healthy Kids programs, and these counties said, we're using Healthy App, we think it's a terrific tool, we'd like to integrate our program into that application, and out of that was born OneEApp.
So the evolution to OneEApp, we feel like we were being the pioneers and we were helping the state move on to a direction, where we want to go. It comes down to what would be best for our families, what would make this application process, getting health access easier for them, and looking forward to what it can be in the future.
This is reform. It requires vision, it requires resources, and it requires collaboration. San Mateo really stepped out the door on all 3 of those fronts.
It's streamlined the application process. Where else can you find one application tool that can screen and determine eligibility for all the health coverage programs in the county?
¿No ha aplicado a Medi-Cal en los últimos 6 meses? Ninguna aplicación pendiente, ¿verdad? Ninguna otra aseguranza.
Before OneEApp, the CAAs in our county is known as the bag ladies because we carried it on suitcases like the flight attendants everywhere we go, and we also had a portable copier. It was really crazy. With OneEApp, the family just go through one application. The questions are only asked once, and at the end of 30 minutes, you know what the eligibility is.
The certified application assisters, the people who actually work with clients to do the applications, and the county eligibility workers who work with clients really are excited about the program. It gives them the ability to manage their caseload in a way that they weren't able before, to really be as responsive to their clients as they can.
Usted no hace gastos para nada, ¿verdad?
During one of our monthly coalition meetings, we went around and said, what do you like most about One app? I no longer have to use a calculator. No more determining what income would count or what deductions I have to take for the family. I just enter in documentation and I know the eligibility.
One app does everything for you. It's telling you automatically what program, what they're eligible, what's the family size, what the ages of the child. If they are eligible for a program that you didn't know about, it doesn't waste a lot of our time and the client's time for them to come and apply. Time-wise is really fast. My families love the program. One family in particular, it was a baby that was going to die. And they came here and the baby started having like seizures in my office. So the baby got insured. They just started taking him to the specialty doctor, and it makes you feel that you're helping out somebody that needs it. To see the doctor, which is you could save a life that you didn't know you were able to. Seguro Social tiene
One app is really the vision of the future. You get on a system, put in basic information about yourself, and we as government say, you're eligible for the following 4 out of 10 programs that government offers its people.
One app is either being used or being implemented in 11 California counties, including large counties like Los Angeles and Alameda, and in some smaller counties we're implementing in Humboldt County right now. I think all of us at the center are very grateful to be able to be part of the solution. We take our charge very seriously. We know that while we are passionate champions for One app and all that it can be, our work can't be done without the counties, without the community-based organizations, without the providers and those people who really serve the public every single day.
The One app program is a really striking example of how the use of modern technology can help solve one of the really vexing problems in California, which is trying to get people who are eligible in publicly subsidized health insurance enrolled in those programs. We think technology has an important role to play in a number of areas, in improving patient safety, in helping patients and their providers help manage chronic disease, in all sorts of areas in which healthcare is too expensive and too inaccessible for people now. So in the next 10 years, as in the last 10, we at the California Healthcare Foundation intend to continue to try to find ways to use modern technology to help solve some of our most pressing problems in healthcare, particularly in access for people who are disadvantaged or underserved.